Good evening. Welcome, everyone. We are so happy to have you. I'm Karen Forston with the Prevention of Blindness Society, and the Prevention of Blindness Society has been in existence since 1936, and we focus on local vision health in our region. So that's the suburbs of Washington in Montgomery, PG County, Alexandria City, Arlington County, and Fairfax County, and the cities located within those areas. And of course, the center, Washington, D.C. And so we are really excited. This is our first Love Your Eyes campaign, but it is an education campaign, and we are taking this opportunity to talk about, each session we'll talk about different topics, but we're able this time to talk about some topics that we don't normally get to cover in our regular support groups or monthly town halls. And so we're so glad that you have joined us. And because it's Valentine's Day coming up soon, our board has put together, they have curated some auction items. And you know, you don't have to have a special someone. There's all kinds of people in your lives that you want to celebrate at Valentine's Day, whether it's a sibling, a child, a friend, or that special someone. And there is something for everyone. And there's even a few things, if you just want to show your love to the whole community, you can support the Prevention of Blindness Society with some unique items. So I invite you to check out all the talks that we're giving during this 1 month period. They're available on Love Your Eyes DMV. That's .org. So loveyoureyesdmv.org. And any of the talks that have already passed, we'll have recorded and they'll be available so you can share them with a friend, or if you missed one that you really want to learn about, especially since we're doing things that we've never done before, topics that we haven't had a chance to do, check them out. But I am going to turn this over to Dr. Rena Garg, who is a board member for the Prevention of Blindness Society, and she's going to introduce our special speaker.
Thank you. Thanks, Karen. Thanks for that intro and for the background on the Prevention of Blindness Society. Well, welcome everyone. So happy to be here and so happy to meet all of you virtually. I'm especially excited because I get to introduce our speaker today, Dr. Sandra Cremers. Dr. Cremers is one of the other attendings at the practice that I work, other physicians or doctors at the practice that I work at, called Visionary Eye Doctors. And as a board member, when I was asked who I wanted to invite to come and speak to everyone today, I immediately thought of Dr. Cremers. She just has one of the nicest, kindest bedside manners. She treats one of the most difficult topics that we deal with in ophthalmology, and I'm sure many of you have dealt with or suffered. And one of the things that she always says to me, which I always take it to heart, and I don't know if she even remembers, but she always says that we can always help anyone. And, you know, it doesn't matter how difficult the problem is or how, you know, uncomfortable or miserable the patient is, there's always something we can do to help everyone. And I think you guys will see during her talk that that's really how she kind of carries herself, how she is with her patients. Aside from all of that, she's extremely accomplished. She completed her undergraduate and master's in public health at Columbia, followed by a medical degree at the combined Dartmouth and Brown University. She then did her internship at Harvard and then went on to the world-renowned New York Eye and Ear Infirmary for residency. After that, she spent about 10 years at Harvard, and then she moved down to the DC, Maryland, Virginia, where she practices at Visionary Eye Doctors and also holds an appointment at Hopkins. So we're very lucky to have her here. Thank you so much, Dr. Cremers, for taking your time, and I'm really excited to learn more about dry eyes today.
Thank you, Dr. Garg, for that very generous introduction. And thank you to everybody at the Prevention for Blindness Society. I really appreciate the invitation from Sean and Karen. So very nice to meet all of you virtually. And so the talk I'm going to give today, I'll share my screen here. is important to all of us because it has to do with how our eyes feel from day to day. So as you all listen to me, we want you all to not notice your eyes. We want you to be able to do everything you do normally without noticing that you're blinking or nothing in your eyes, no foreign body sensation, no burning, no itching, no tearing, nothing. If you have any symptoms or you have any family members or friends or neighbors that constantly are rubbing their eyes or notice their eyes, they need to do something, because for the first time in the history of ophthalmology, in the history of the world, we have technology that will help us understand why this is happening, and we have amazing treatments to prevent possible issues that actually, believe it or not, can cause vision loss and in a sense kind of a blindness because of the cornea. The front window of the eye can get so dry, people can go blind temporarily. They'll need surgery, but we want to prevent that. So we're going to go through just a very common type of case that we see in my practice, and we're going to go through how we deal with it. So COVID has been really difficult for many patients, as all of us know this. One of the key things we have seen is the issue of dry eye blossoming during COVID because we're all on screens. So I tell patients, I spend pretty much most of my day telling patients blink frequently. When you can listen to somebody, they're not showing you anything important on a screen, let's say, close your eyes. And that saves your what's called meibomian gland. So I'm going to show you some pictures of this so all of you will understand. So the new research is showing that one of the most common complaints in nursing homes and as we get older is dry eye pain, dry eye discomfort. It is the number one type of symptom or complaint after any eye surgery, including glaucoma surgery, as Dr. Garg will tell you. A lot of patients will complain after cataract surgery that their vision may not be so crisp. They may have a foreign body sensation. They may feel irritation. And of course, part of it is the surgery, but most of it is because there's not enough oil in the oil gland to lubricate the surface. We're going to go through this so people will understand that it is not normal ever to feel your eye, notice your eye. It's like feeling your chest or your pinky. If you feel your chest, it's your body saying do something, because I'll form scar tissue if you don't. And it's very true with the eye, and we can now prove it with technology that we have that I'll show you. So to start, I'll just start off. I have no disclosures, and this is a typical case that we see in the office of a young person, usually 50s, 60s, sometimes 70s, comes in with sometimes a complaint of decreased vision, but then has some redness and burning, sometimes for months. A lot of our patients are on screens more than 4 hours a day. We call it electronic screen use. And a study in the New England Journal of Medicine in about 1998 or so said that 4 hours or less was really what we should aim for in electronic screen users. This was a study in Japan. That's laughable now, as most of our children are on screens more than 4 hours a day, and grandchildren. So we know that this is probably doing damage somewhere, and the question is where, and now we can show you where that is. So patients like this will come in complaining. We try to get a history of what type of medications they used in the past, if they're on glaucoma drops. Things like Accutane for acne can cause problems with dryness in the future, even if they've never had it before. Glaucoma drops with preservatives, medications you take by mouth. Often one of the number one side effects on pretty much most medications is dryness of the eye, or eye dryness, or foreign body sensation of the eye, because a lot of medications can dry out the tear film. So this patient was similar, had LASIK before, also was a contact lens wearer. A lot of patients that are on birth control for years can start to have issues as they get older. And this patient had tried multiple things, different types of warm compresses. We recommend heat, blinking, trying to decrease your screen time. There's a whole series of options that I'll show you in a few minutes. And she had tried quite a bit and she still was not better. And she also had a cataract and she wanted to see better. So we knew she was going to need cataract surgery. So as we treated her, we saw on the microscope, which is called the slit lamp microscope, these tiny little mites on her eyelashes called Demodex, which is very common as we get older and very treatable. And a lot of patients don't realize that when you wake up in the morning and you have morning crusting, that's not normal. You shouldn't have that. It's a combination of dead cells, probably mites, and some bacteria, and you got to clean it off. And you want to wake up where you don't feel that crusting. If you have that crusting, you probably have these Demodex mites. You can go to your eye doctor to look under the microscope if you want confirmation, but there's many things you can do to treat it. And we have blogs and podcasts and all these things that discuss how to treat this very simple issue, but using either diluted tea tree oil or these special wipes you can get over the counter will help kill these mites. And these mites will literally cause dryness in a particular way, which I'll show you in just a few minutes. So she had mites. We had to take care of that before we were going to do any type of surgery. She was pretty red on her eyelids. You could tell that she had quite a bit of dryness from both the oil component and the water component. So each tear you produce, when you have a tear coming down your face, most often it has a majority of oil. There's some water, and there's something called mucin, which is a molecule that mixes the oil and water together. We have a way to kind of assess the water. It's called the Cremers test. And we have a way to now assess the oil. We don't have a great way to assess the third molecule, but that's basically what's going on. So she had an aqueous deficiency, which is water, and an oil deficiency. And so whenever we see that, we ask some particular questions, especially if we're going to do cataract surgery. And she had a pretty dense type of cataract that was associated with patients that have used steroids in the past. So this is new technology called a meibography. It's a big, long word that tells us we can finally look at the oil glands along the eyelids that produce oil. And this is revolutionary because when I was at Harvard many years, I remember very clearly when I sent a patient to a very world famous ophthalmologist. I know he would not mind me telling his name because he's repeated this before, but he, Dr. Stephen Foster, world-renowned uveitis specialist. I sent him the hardest dry eye patient I could find because she was 80 years old, very miserable with her eyes. We had tried everything. And back then we only had warm compresses, and cyclosporin Restasis had just come out and it wasn't even FDA approved yet. So this was many years ago. When I sent this patient to him, he was so upset. He literally called me, Dr. Cremers, don't you ever send me a dry eye patient again, because there was nothing we could do. So the technology I'm showing to you right now is breakthrough information because we can tell you your risk of having debilitating discomfort that can drive even the best surgeon in the world crazy because there's nothing we can do. So we want to treat symptoms of dryness, foreign body sensation as soon as we feel it. Because if you wait, again, it's your body telling you, I'm forming scar tissue, do something. Because if you don't, it can be irreversible or very, very expensive and very difficult to treat. So on the left, you'll see these glands, these white lines that are filled with oil. And as we get older, they dry up, and we all dry up with aging. There's no cure for aging, but we have now many ways to slow it down. So this is kind of another example of the grading of the meibography. This is the patient's right lower lid and the left lower lid. And if you can see these little white on the top left in that little box there, you can see these on the eyelid. What looks like an eyelid are these little white dots. That's the remaining oil. So she's lost a lot of oil, and that's why her eye is so red. That's why her eyes are really uncomfortable. And so so normal is coming up there, and then now you can see how the oil starts to dry up. So our main issue is that we want to basically save her glands before we do cataract surgery. So here she is, a relatively young woman who has cataracts, wants to have state-of-the-art cataract surgery, which now includes something called femtosecond laser cataract surgery, which is the best technology in the world. It is for sure the one I would choose if I needed cataract surgery. I'm sure most surgeons would choose femtosecond laser because it makes the surgery for cataract super precise and decreases the risk of having complications, needing another surgery, risking even potentially vision improvement over the long term. So we're very excited about this particular laser that makes surgery safer. She also was very adamant because she did a lot of research that she wanted customizable implants. So this is also brand new technology that is just coming out where we can customize the lens implant we put in your eye after the surgery. So before we would have to kind of use our equations and do measurements to see what kind of implant we would put in. And once we put that implant, you may or might not need glasses afterwards, but we cannot change the implant's power. Now we can customize that lens so you can see how your vision is for distance, intermediate, and reading, and decide if you want a little bit more power for reading, a little bit more power for distance. If you have some astigmatism, which is the front surface of the eye, or the whole eye causes a kind of shape of instead of a basketball, American basketball, it's like an American football, which distorts vision quality. So now we can correct this after the surgery, which again it's amazingly revolutionary. So I tell my patients all the time, it's the best time in the history of the world to have any dry eye problems, have cataracts, have glaucoma, all these things, because we have so much incredible technology. So we're doing a great job of really trying to prevent blindness and help patients. So she also had this meibomian gland dysfunction, and as well as Accutane. But still, because of the amount of oil that was lost, we have to ask a very important question. So whenever you have dryness of the eyes, we always have doctors really ask the questions, do you also have dry mouth and arthritis? Because it's all connected. It can be all connected. So if someone has dry eyes, dry mouth, and arthritis, we think of autoimmune disease. And so really in her, we did a blood workup, which is pretty easy to do. And she turned out she had something called Sjogren's syndrome, which is an autoimmune disease. And so in the end, here she came in with a cataract, had, of course, dryness, was an Accutane user, which also can cause more dryness. And on top of that, she was a recent diagnosis of Sjogren's syndrome. So this has basically made us realize, of course, we do this every time before we do cataract surgery, we have to focus on improving her tear film. And so why do we want to do this? Well, really the tear film is the most important part of vision. Once the cataract is gone, it will determine the quality of vision. So everyone can prove this at home, and not that you want to do this necessarily, but if you don't blink for 3 to 5 minutes, you'll have terrible pain and your vision will be incredibly blurry, because your tear film, the oil, is important in the quality of your vision. So the quantity often can be due to the health of the optic nerve. So if somebody has glaucoma, they may not see peripherally and then centrally, or if they have macular degeneration, they may not see centrally. But if you don't have those diseases, you probably will have 20/20 vision after cataract surgery in most cases. But the quality depends on your tear film. So I always try to show my patients their meibography before cataract surgery so they can see what their prognosis is on the quality of vision. We have patients all the time that come in for second opinion and say, I just can't see, it's too blurry. And we check them and they're 20/20. And I'm like, well, you know, you're 20/20, but then I show them the meibography of their oil and they're like, oh, this is the reason why. And what we try to do is to save those oil glands. So basically the tear is crucial for quality of vision, quantity of vision, the quality of the measurements we use to actually try to pinpoint what implant we're going to use. It, of course, is important with the symptoms of pain, foreign body sensation, redness before and after cataract surgery, as well as the healing time for your cataract surgery, so you're not feeling that foreign body sensation. And of course, basically the actual vision. So those are the key things that the tear film is in charge of. And most dry eye is due to meibomian gland dysfunction. We published a paper last year in the American Journal of Ophthalmology showing how this oil gland issue is very common in children, mostly because of screen time. And so what's going on is people are not fully blinking. We're concerned the blue light might be causing inflammation in some patients. The blinking or partial blinking, people are getting addicted to screens, especially young kids playing video games, TikTok. It basically causes the oil to dry up because you're not fully blinking, which is like milking a cow. So if you don't milk a cow, it's going to dry up. And if you don't fully blink over hours and hours and hours, the oil starts to dry up. And we're very concerned. And what we're seeing is that this is affecting more than 16 million people in the US. It's 344 worldwide. It's costing billions of dollars, and it increases with aging. So a brief word about Sjogren's syndrome, because many patients don't know they have this. And so we do, one of the first symptoms many people will have is dry eye symptoms, even before the dry mouth and arthritis. And that's what the paper published in the children, that we could use the meibography as a diagnostic way to determine if there was autoimmune disease going on. So I've diagnosed more autoimmune disease in the last 6 years that we've had the meibography at visionary eye doctors than I have in my entire career at Harvard. It was amazing. So it's been very helpful And so we're trying to publish a second paper to show that as a diagnostic criteria. So Sjogren's is a autoimmune disease that's associated with many different types of dryness of the eyes and the skin, and it's basically mucous membranes, neurological issues, memory issues. And there is also a slight increase of actual leukemia and lymphoma cancer in Sjogren's patients. So we try to catch it early. Patients also with dryness, especially with oil gland loss or meibomian gland atrophy, could have lupus and rheumatoid arthritis. And again, we want to treat these early because it will help prevent deformation of joints, scar tissue throughout the body. So the Sjogren's, I briefly mentioned, there's a risk of lymphoma. It's actually a 6-fold increase. So we do want patients to be diagnosed early. We want to prevent any type of cancer that could have been caught early. And we know that dry eye syndrome or dry eye disease is a potentially chronic condition. It can be painful. It can even lead to loss of vision. In quality of life scores, it's been compared to chronic angina. So imagine a patient, your neighbor, your spouse, a friend, your child, your grandparent, your parent, just having constant chest pain. You know, that is very debilitating. And so patients that have this type of discomfort, it can be debilitating. It can drive people to suicide. And we take it very seriously because we have had patients that really want to jump off the bridge because they're with their eyes morning and night, and it can drive you crazy. So we really take it seriously. So the symptoms, we've talked a little bit about dry eye symptoms. Let me tell you about the symptoms and then the risk factors. Symptoms of dry eye can range from tearing, like reflex tearing, because the eye is dry. So if you don't blink, everyone will start to tear if the eye tear film dries up. Burning, redness, foreign body sensation, itching can be a kind of related to dryness for sure. Any type of kind of just dryness, pain, those kinds of things is what we're looking for. I've had people even come in with just headaches and have significant meibomian gland dysfunction. So those can be the symptoms. Risk factors, the number one is used to be aging. Now it's screen time, I actually would think, and actually young people especially. Genetics, of course, hormonal changes, contact lens use, rosacea, refractive surgery, Accutane, previous trauma, surgery of the eyelid or the eye, glaucoma drops, medications, systemic diseases like diabetes, autoimmune disease, allergies, Demodex, those things can make the dryness worse. And so your ophthalmologist or optometrist now have amazing technology to kind of catch this early. And if you feel like you're just not getting better, find someone that has a meibography because it can really help you understand where you are on the kind of spectrum and potential outcomes for your future. As you treat, will you improve quickly? Will it take longer? So even though there's no definitive diagnosis, a diagnostic test like saying this for sure is dry eye, we do have the microscope, slit lamp, the Cremers test, the meibography, tear osmolarity, MMP9. These things do help. And so your doctor will be looking for redness on the eyelid, on the conjunctiva, the clear covering of the white part of your eye. They'll be looking at your cornea to see if it's staining and there's inflammation. They'll look for excessive tearing and of course check with your vision and check your vision. And if you don't feel better, you ask to see a dry eye specialist for sure. So what we do generally now before any cataract surgery is we do a meibography. We talk about the importance of the tear film. We recommend warm compresses and blinking and massaging on everybody if you can do it. Some patients with rosacea cannot do any type of heat because it makes their eyes so sensitive, but heat is the only way at home to milk the oil with the massaging and blinking. So that kind of blinking, massaging, talking with your eyes closed, printing out material at work. Don't worry about the trees, I tell patients. Some young people are now taping the eye if they're at the computer, one eye at a time, if they're not driving or walking, to take breaks because they have so much dryness. So there's things you can do even just at home. And then we talk, of course, about things like FDA approved drops. First we talk about diet. I'll show you this little kind of whole list of options in just a moment. We talk about diet. We'll go through that in a minute. Artificial tears. So this has now become so much options. When I was a resident, as I told you, really all we had was warm compresses, artificial tears, and Restasis just came out. And now we have a whole series of tools for our toolbox that can help patients at different points of their life. If they're working 8 hours a day or 12 hours a day on the computer versus getting older, retiring, but now have morning dryness, we have pretty much all the tools in the world at our disposal to help patients get better. And we can categorize them in many ways. It's still quite confusing. We have a podcast called the EYE show that tries to break it into little chunks. Sometimes we're successful with that. I have a blog and do all these kinds of things trying to educate patients because we're all in this together. I post my biography usually once a year or twice a year to show patients Dr. Cremers is getting older. Her glands are also drying up. I'm in this with you. So it's one of those things that my husband has dry eyes. A lot of my friends have dry eyes. I'm not so much worried about my generation. I'm worried about Gen Z and Gen Alpha, whatever's the next one. So pass this on to your children, your neighbors, your family, your kids, because the kids are in trouble. That's my concern. So these are a lot of the treatments. And just as I mentioned, the first tier, and this is my original step ladder sheet, which kind of goes through all these tools, very overwhelming information. But some of my patients at Harvard just wanted it on one sheet. And it used to be just like 4 things on one sheet. Now it's 20, I think we're at 23 things. So this is kind of blossoming because of more information. So let's say you're sitting here, you're listening to me, and you're saying, you know what, I feel my eyes, I feel a little discomfort. What should I do? So the first thing I do, and everyone should do, is either try the warm compresses, heat, massaging the eyelids, blinking. I've been known to pinch my eyelids, which I'm sure does terrible things for wrinkles and drooping of the eyelid, but sometimes it's uncomfortable. That kind of pushing the oil out manually with your fingers really helps your eyes feel better. If I'm wearing contact lenses, or, I would take them out right away. If you feel your contact lens, you take it out right away. Then you can start using artificial tears, and preservative-free is the name of the game. Now, having had preservative drops for the last 40 years or so, we were concerned that the preservatives actually can damage cells over the long term. So we try preservative-free drops. They come in usually these little small containers that are difficult for older hands, but now there's some that are bigger bottles that make it a little easier if you're older or you have a family member that's a little older and they have to give themselves drops, which is not easy. We talk a lot about diet. I talk a lot about trying to decrease your gluten and sugar and dairy if you can safely with your doctor's permission. We know that gluten and sugar increase inflammation, and the name of the game with aging, death, blindness, pain, a lot of it is inflammation. So if we can decrease inflammation, there's some data to show that you can decrease your risk of cancer. There's data to show that diabetes type 2 is curable and preventable and treatable, very, very treatable, getting you off medications with diet alone. So look into that. Again, I have the podcast that I go into diet at length. I'm doing this particular diet myself, gluten-free, sugar-free, dairy-free, and trying to just do a fasting, exercise, drinking a lot of water, blinking. All these natural things are in step 2 to kind of help patients know that there are a bunch of natural things that can help. Humidifier, HEPA filter if you have itching, eating omega-3, even though some of these things are not proven is as incredibly cure, there's no cure. They are helpful, but some of them are not proven. But we've had so many patients tell us this is worth a try. It has very little risk of harm. So our number 2 on the step ladder are all the natural things you can do for dryness. And then number 3 is the non-preserved artificial tears. And now there's hundreds of them. It's hit or miss which one you're going to like. You got to try a couple of them. Most people will use them about 4 to 8 times a day. Whenever you feel your eye, you might need to try the warm compresses, or then cold if the heat makes the eye worse. Or if you can't do the heat, cold is for pain, swelling, redness. But heat is the only way to keep the orifice open. And then artificial tears if that's not helping. So that's how we first start those first 3 tiers. And then the Xiidra, Restasis, Cequa are the FDA approved drops, but a lot of patients either don't get coverage for those medications or they burn too much. They pretty much all 3 burn, in which case we will sometimes use a patient's own autologous serum or platelet-rich plasma, which has been a big game changer because we can actually take the cells of a patient's own body and use it to heal their tissue, which has been very helpful. So here's just a rough idea of the first treatment parts of the step ladder, and then my blog has a lot more information, but just to have an idea that we have now a lot of options for dryness. So don't give up. If you feel like you haven't been helped, you let us know. So LipiFlow is what this patient had. It's the first FDA approved procedure that's called thermal pulsation, whereas this basically the idea that you're putting heat and then pressure, kind of massaging the oil out. And so the LipiFlow is meant to slow down the gland loss. It is not a cure. It is not covered by insurance. Actually, I think it might start to be covered by insurance, but it's not a cure. And we do recommend doing the LipiFlow sometimes twice a year because it's very effective. It kind of slowing down the gland loss. For her, LipiFlow didn't help. So then we talked about intense pulse light. So you can see this little picture, hopefully here in the corner left, of a light source, a very intense light. It's not a laser. And it's it's used along the eyelids to help get that oil to come out by liquefying the oil, opening the orifice. It kills Demodex mites and it decreases inflammation. So intense pulse light has been used for years for women that have either rosacea or wrinkles or tattoo removal. It's used for all kinds of wonderful treatments. We use it around the oil glands, and then we express the oil under a video camera so patients can see the quality and the quantity of the oil so they could understand the problem, they can see the problem, and then it's also therapeutic. Multiple IPLs help the oil come out like gushes of olive oil. So if you have your eye symptoms of burning, guarantee, well, I'd say close to guarantee the oil is coming out like toothpaste or not coming out at all. And it's not coming out the way it should, which is like little gushes of olive oil whenever you blink. A little gush of olive oil is supposed to come out of every single one of these microscopic glands. And then if that doesn't help, we'll do something called meibomian gland probing, where we go into every orifice, which can be uncomfortable, and it is not FDA approved yet, the probing, and it is expensive. So that's why we treat symptoms very early on, because we have wonderful options, but the big options, the kind of big guns, are not covered by insurance and they're uncomfortable. So we know that the electronic screen time is a big issue. So the main two goals of all these treatments are to save the meibomian glands, number one, and number two, get rid of your symptoms. We want to do that also because we do not want patients to develop neuropathy. And that's where there is a pathway between either the eye and the brain, or even within the brain, that the brain just starts sensing pain, and it's very difficult to treat because patients can't get out of that feeling like they have constant pain, even though they shouldn't have any eye pain because we give them anesthetic on the eye, they still sense pain in the brain. So that's important to keep in mind. That's why it's important to treat this early. So our patient's outcome was basically did the warm compresses, didn't really help, was doing the blinking exercises, which is basically every 20 minutes taking a 20-second break, looking 20 feet away. She'd been doing this for a while. It didn't help. The LipiFlow really didn't help. So she had to have multiple rounds of intense pulse light and meibomian gland probing to get her symptoms to go down from where she was. I think initially she was like 8 out of 10 to a 2 out of 10. It improved the inflammation of the cornea. Her glare test was still positive because she had a cataract. And so we're finally at the stage after months of finally about doing the cataract surgery. So she's scheduled to have cataract surgery in the next month or two, but it takes time. And so this is years and years of dryness kind of getting stuck in the oil glands, or the oil glands kind of getting stuck and starting to dry up and forming scar tissue. And it's a process. If we had a magic cure, we'd give it to patients right away, but we don't. We really want to try to help patients kind of slow and save those glands that they have. It's kind of a race against time, and then help with the symptoms. So please, if you see anybody that has red eyes, or please tell them, please do something, because it gets worse over time. So the take-home message is, before you invest in either eyelid surgery to do an eye lift, or cataract surgery, or any type of eye surgery, pay attention to the meibography and ask for it. You might have to even ask for a meibography, because a lot of doctors are still just starting to get this new technology, but you want to see it for yourself. You want to know that, what your prognosis is in terms of having dryness after the cataract surgery, or any surgery, because you probably will. The classic ones, of course, are cornea or cataract surgery, glaucoma surgery, oculoplastic surgery, where they do lid lifts. The dryness will probably get worse from the surgery, at least for a period of time. LASIK, refractive surgery, PRK. There'll be an issue with dryness after, and what the length of that dryness or pain from the dryness after the cataract surgery, how long is that going to last? That's the question. What's your recovery with the discomfort? A lot of it can be based on how much oil you have. So if you have a lot of oil on your meibography, you probably will bounce back very quickly, usually within 5 to 7 days. If you don't have a lot of oil, it could be months, and it's good to know that before your surgery. So be sure to ask for that. I personally think every person in the world should have a meibography every year if they're on screens more than 4 hours a day, because you need to see why you shouldn't Twitter and do all kinds of TikTok and all that kind of stuff, because it's going to come back to bite this next generation. So I really do it on my own kids every year, partly to remind them you cannot be addicted to your phone. You have to take breaks, take care of your eyes, because you're going to start to notice it. And as I mentioned, we published a paper last year in a very prestigious journal, and the average age that we evaluated was 15. The range was 8 years old to 18, a whole series of young people. This is pre-COVID data. They weren't even on screens because of COVID, and they were losing their glands at record pace, primarily because of screen time. So keep that in mind. It's quite scary. So if your surgeon doesn't address the dry eye before the surgery, you may feel that the dry eye was caused by the surgery, but we tell patients, very often when they come for second opinions because they're angry at their first surgeon, this was a tipping point. You were already set up to have issues with the quality of your vision or symptoms before the cataract surgery because you had less oil. And most often that dryness of the oil takes time to kind of develop. So scar tissue takes time to develop. So it wasn't necessarily that the cataract surgery caused it, but it definitely contributed to it. And it's because you had a lack of oil to begin with. It might have not been known. So if you love your you will love your eye doctor if they save your meibomian glands and treat your dry eye symptoms. Trust me on this one. And just a reminder that this kind of what we call screen-induced dry eye disease and computer vision syndrome has now become essentially a pandemic worldwide. China is being hit very hard with this, and they're trying to crack down with screen time for kids, for instance. But it does affect the quality of your life. Chronic use of these devices can definitely, increase your eye symptoms. It's important to blink and take pauses as you blink. This is going to be good for not only your oil glands, but if you have younger children or even people in their 20s, then the risk of myopia, the eyeball growing, and when they're young, decreases also. So looking away, taking breaks are crucial. If you have dryness, always ask yourself, do I have a dry mouth? Do I feel like I have to always have water, especially if I have a saltine cracker was a classic question, or do I feel like I'm always dry, or do I have a joint aches? You should never have joint aches or backache or any type of aches in your joints. So if you do, you've got to tell your doctor. And then the basic points on how to prevent meibomian gland atrophy is the warm compresses, the cleaning, little gentle massaging. If you don't have glaucoma, if you have glaucoma or you've had glaucoma surgery, check with your glaucoma doctor, the blinking exercises. And then the more advanced way to save the glands are things like LipiFlow. There's now iLux, tear care, a whole bunch of different treatments in the thermal pulsation category. Intense pulse light is a light that decreases inflammation, and with meibomian gland expression does a really amazing job of keeping the oil pumping and helping with symptoms. Those both are FDA approved, and meibomian gland probing with expression is not FDA approved, but it does work to help symptoms. So those are the advanced ways to do this. And then the last things in terms of kind of helping with the symptoms are, of course, the things we talked about: over-the-counter artificial tears, non-preserved, omega-3, Xiidra Sequa, punctal plugs, which is a little cover over the drain that connects the eye to the nose that keeps the tears in the eye longer. I love autologous serum, platelet-rich plasma drops, and cord blood serum drops because they've been big game changers in really helping heal damaged cells. That's what they do. And these are non-controversial drops because they come from the patient's own body, or they come from a donated placenta. The baby's been born and is in the mother's arms, and we take the donated cord and amniotic membrane, and it's been a very incredible help to our patients. Testosterone ointment has also helped. Scleral contact lenses are basically a Band-Aid. They don't help the symptoms of, they don't treat the disease, but they do help the symptoms. So it's basically just a contact lens to prevent the eyelid from rubbing against the eye. And then we always talk about allergies and environmental issues. So we always get an allergy test, look at the medications, just go review that with patients. So those are the key things that we talk about, trying to encourage patients to think how to decrease their symptoms. So those are the key things we recommend. As I mentioned, blinking every 2 or 3 seconds, looking away, consider a blue light filter screen on your screen to kind of protect your face from the blue light. So that is basically the message of the day, is to really love your eyes by blinking frequently, closing your eyes when people, that know you are talking to you, if they don't mind, and really saving your eyes for eye-worthy things. So I tell patients this all the time. I say, when you talk to Dr. Cremers, close your eyes. She's not going to mind. And they just look at me as if they just can't blink, which is incredible because their brain has been so used to being attentive, they literally are forgetting to blink. And that's the generation that we're concerned about. So thank you to all of you for joining me for this podcast. I'm happy to take questions. Oh, and please, you're welcome. You can write this number down. Katya gave me permission to give out her cell phone number. So if you have questions, you want to make an appointment, or you have questions for us on this talk, her cell phone is 301-452-3523, and we're Visionary Eye Doctors, so you can welcome to check us out.
All right, thank you so much, Dr. Cremers. That was unbelievable. I know the first thing I did when you shared the photo about the mites was I ran to a mirror. I had to check myself. So for folks on the call here, you can put your questions either in the chat box or in the Q&A. Alternatively, you can raise your hand if you would like to ask verbally. I'm happy to allow that to happen. While we are waiting for that, we did get a question beforehand that somebody wrote in. And this has to do with, their eyes get very tired throughout the day, and it causes them to kind of have whole body fatigue, feel like they're tired, they need to rest. And the question was, is there a way to deal with this?
Yes, great question. It is amazing. I don't know if any of you out there have ever had a little sty, but it can be incredibly debilitating. And when I had my first sty, I was shocked by my whole muscles in my neck and my body were hurting. I had a headache. I'm like, this can't be just from a sty. This is impossible. But I think it really was, because when we lanced it, before we had my biography, before I knew the dangers of lancing a sty, the symptoms went away. So it is related, and it can be related from a combination of issues. It could either be the lack of oil that affects the nerves of the cornea, which then can trigger other nerves in your brain to sense discomfort or sensitivity to stimuli as pain. That can be a cause. It can be from muscles that round the eyes that also maybe feel fatigue from the dryness, lack of lubrication. So for those patients, we do try all the local things in terms of warm compresses, blinking, massaging. I'm a big believer, as I mentioned, on trying the gluten-free, sugar-free diet, which is not easy, but it's definitely possible. I'm living proof. It's that kind of thing can help, because we know that tiredness of your muscles can sometimes be due to inflammation as well. So things like CrossFit training, there's actually 2 papers that have come out saying that aerobic exercise once a day for 30 minutes helps dry eye symptoms. And the thing with that is why would that help? Well, it probably decreases inflammation. I've told some of my patients that maybe you have so much discomfort in your muscles that your eyes don't hurt as much. So I don't know why it really is ultimately helping the symptoms, but even though you feel really tired, pushing yourself to do a little exercise, walking an extra, 1,000 steps, or just going up the stairs a couple of times, or trying to get into the pool, or doing something, believe it or not, will help with that tired sensation. So it is all related. There's even papers showing that the gut flora is related to dry eyes. So the more diverse your gut flora is, the better your symptoms will be. Even longevity, cancer risk is related to your gut flora. General well-being is related to your gut flora. So there's things you can do, like kombucha, eating different types of food that can help, like cabbage or fermented cabbage, these kinds of things, yogurt, there's different things, that can help with that. So it's related for sure with the dryness component. Good question. Thank you.
Thank you. And we had a question in the Q&A box. Let's see. First, I want to let you know the PRP eye drops haven't done the trick for them. What are the risks for cord blood serum? Like risk for cataracts, like with steroids, is it compatible for everyone?
Great question. So cord blood serum is I think it's an incredible option drop. We have the first patient we ever used it on was a very high powered lawyer who was about to commit suicide. And we had tried everything at that time that was approved. And we got what's called an investigational research protocol. It's a board that gives us permission to do this research. I had a friend that was delivering a baby, and she donated her placenta. We got the cord blood, and we checked the blood for everything, for all the communicable diseases, and it was obviously all negative. And so the patient used it, and he called me from the beach crying, saying, I just want you to know this is the first time I've been to the beach in about 15, 20 years, because I haven't been able to go out anywhere like this where it's windy for 20 years because of the pain. The cord blood serum was miraculous. That was his words. And he's gone on to use the cord blood serum off and on for the last about probably 6 years or so. And it's not a cure, but it's amazing because it's not controversial. It's not like aborted fetal tissue. It's a newborn baby that's in the mother's arms, and we just take the cord blood and or the placenta. Sometimes that's also helpful. And so we basically use it as a way to heal cells on the corneal surface, just like an embryonic stem cell potentially could. But the research with embryonic stem cells of aborted fetuses have not shown to be effective the way postnatal cells are. So we've been kind of surprised by that. So that's been very helpful. And so the risk really is contamination, or it's, let's say that the person using the cord blood serum, let's say they donate it, they have HIV or syphilis or something like that, or hepatitis. Theoretically, you could pass it on to the recipient, but so far there's been no case reports of that happening in the world literature to date. Most of the cells, it's in a way similar to a kind of a platelet transfusion or blood transfusion from another person. So it's very similar to that. So the same risks apply. So the risk of hepatitis or that kind of thing is very low, especially if you're going to a place that actually just check it. It's been very helpful, but expensive. So we only use it under specific protocols in patients that have really tried everything. The platelet-rich plasma is not helping, which is rare, but can happen. But it does help. It's been a real game changer. And there's something called Regenerize, which I forgot to mention. I'm actually on their board and I believe in them. They're a great company where it's basically crushed up amniotic membrane in drop form. And so again, it's non-controversial. I don't have any moral issues with it all because it's supposed the baby's already been born, but they take the amniotic membrane and crush it up and they use it as drops. So I think that does help. We also in the office use amniotic membrane that we use. Baby's been recently born. We put the whole patch on the whole amniotic membrane on the eye. We'll patch the eye usually for about 12 to 48 hours. And that has also been a game changer for our patients. So there's something called Procara, which is amniotic membrane in a ring. It's like a contact lens and it stays usually for about 5 to 7 days. But a lot of my patients find the ring very uncomfortable. So for those patients or patients that don't have time to deal with the ring because it's a little uncomfortable, we'll use amniotic membrane on the eye, patch it, and it does a really incredible job to help patients. So if PRP is no longer helping, I highly recommend trying cord blood serum because it's not, you don't have to patch the eye for 48 hours. Amniotic membrane is still covered by insurance. So I would highly recommend getting that as quickly as possible because that can be a big help. Good question. Thank you.
All right. Thank you. I have another question here. I just started waking up with one eye crusty. Is that inflammation?
So as I showed that, I think fourth picture on the presentation, it can be inflammation. It can be these little mites, which we all get. It's like bacteria in your mouth. You know, you brush your teeth in the morning. By the end of the day, the bacteria is all back. Brush it at night. By the morning, it's all back. These mites are similar. We don't know why they're there. They're all over our body. The studies in the past have said that 70% of 70-year-olds have it, 80% of 80-year-olds have it. Pretty much everybody in the world gets them at time to time. They're just mites on our bodies, but they tend to get on the eyelashes. And what we find is if you have crusting, they're probably back. And so if you're like sleeping on one side, theoretically, maybe one side might be worse, or it could be just kind of inflammation if your eye's opening underneath, or there's something, you know, different between the two eyes. But I would just recommend cleaning the eyelid. First, you could try diluted baby shampoo, and then you can try over-the-counter kind of sprays. There are different ones called Avenova, Avenova, or Optase, Optase. These are new products that kind of clean the Demodex mite away, and they usually are very well tolerated. So I would try one of those to see if you can get rid of that crusting.
All right.
Good question. Thank you.
Thank you. Thank you. So one question I have is, we talked about all these different treatments that are available for dry eye. When is the kind of determining factor of when we need to go from seeing my general practitioner to seeing a specialist in dry eye?
So really, it's a matter of feeling improvement. And I really mean it, that you should never notice your eyes. If you notice your eyes, like if you feel yourself blinking, or you feel discomfort, or you feel like you just can't pry it open in the your eyes open in the morning, or you feel like there's any type of tiredness or redness or tearing or itching, you need to see your doctor. If you're not better in a week or two, we treat it very aggressively because we have seen people jump off the bridge, you know, that kind of thing. It's not seeing, but you know what I mean? They're very, very despairing kind of situations. And any chronic pain condition can be very, very unfortunate to have. So we have ways to prevent that. So we really treat it aggressively. So I would say if you're not better in a week or two, you try something else. And if you're not better, you ask to see the dry eye specialist.
Is there a particular warm compress mask you recommend?
So that's a great question. I have two favorite ones. I used to use warm towels. People have seen me in the office with paper towels and a microwaved cup of water, like just kind of walking around, like, kind of doing this, or, on the typewriter, your computer, rather, I should say, kind of doing this. So I do that at work. I have one called a Wizard and one called Aroma Mask. They're on Amazon available. They plug in next to your bed. They have like a USB drive. You can put it, connected to the computer, which is very ironic because that's the probably, cause of it. But I put mine next to my bed. So before I go to bed, I put it on my eyelids. It stays warm for some of them stay warm for 15 minutes, some for 30 minutes, some for 60 minutes. And I just put my fingers on top of this kind of mask, and then just gently massage or blink hard underneath to try to get that oil to come out. If I wake up in the middle of the night, I'll put it on. If I wake up early, I'll put it on. So I really do try to get my 15 minutes twice a day by doing it.
Thank you. All right.
Yeah, great question.
Is Refresh Optive a good dry eye drop, and how many times a day should it be used?
Yes, there's really most of the drops that are preservative free are very good. We're just looking for just natural tears. There's a whole kind of controversy, which is the best drop. Many years ago, Harvard did a study where they compared without any drug company money, and they saw that what's called MGD drop, Retain, it's called RETAINE, was the best. But I think that's now about maybe an 8-year-old study. So now there's been even more, drops that are available. So I would tell patients preservative free is number one, and then just try different ones to see which one works. They all probably have a very positive benefit with symptom relief, but they don't heal your cells. So they're mostly just kind of band-aids trying to help the symptom. They don't do any harm as long as they have no preservative free, as far as we know. And so you just have to kind of try different ones will work better than other ones. Sometimes some people are allergic to one versus the other, even if there's no preservative. So hit or miss, kind of trial and error is really what you need to do. But that's a very good option. That's a good drop.
And speaking of eye drops, there's eye drops that we see all the time over the counter, things like Refresh, but then we also see ones that say like get the red out. Is that the same thing as dry eye disease, or is that
great question? Very good question. So things like Visine, the classic Visine, which is basically has a chemical in it like phenylephrine or something to blanch the redness, is potentially dangerous because of the preservative and the chemical. So we want to try to obviously treat the underlying cause of the redness. And that redness, whenever you see redness, pretty much anywhere in the body other than your blood vessels is inflammation. Abnormal redness is inflammation. And so what we're trying to do is trying to naturally find the reason so we can stop the redness from the root cause. But of course, if somebody has a party or something like that, they want to use it, I prefer to try putting your artificial tears in the refrigerator or freezer for a few minutes to try to see if that coldness will blanch the blood vessels. It often doesn't last, so people will use the Visine. It's not something we recommend because it tends to be what's called a rebound redness, and we do see it from particularly Visine type of products. There's new kind of drops that are being used called Lumify, which is basically like a glaucoma drop actually that kind of tries to help kind of blanch the blood vessels, that are sometimes used as well. And those also have a preservative. So again, being careful with that is crucial. But of course, people, when they're having a big, an interview or a meeting and they have dry eyes and they're very red, of course, they want to blanch the redness out. So we will have patients sometimes use steroids, which I really try to avoid, but it does work. We love steroids because they work so well. But the risk of cataract and future glaucoma is an issue. And almost all steroids have preservatives. So we do try to see if we can figure out one of these options, avoiding, if we can, the Visine category, because that can cause more damage long-term. And then also one other note about allergy. So allergy and dryness go hand in hand. So if there's redness and itching, or there's signs of allergy, or a patient's known to have allergies, we'll recommend a preservative-free mast cell stabilizer or preservative-free anti-allergy drop called Aloe. I think that's the only one right now that's preservative-free, and I'm sure more will come out. But we're trying to treat that kind of allergic component in addition to the dryness, both together. That's a good question. Thank you.
Thank you. All right, we have time for about 1 to 2 more questions. So let's see. If a patient has eye pain, how can we diagnose that it was nerve pain or eye muscle pain or dry eye?
Great question. So the basic way we do that is we use the microscope that we have to see where it's coming from. So we can give an anesthetic in the eye, which should literally numb all the corneal nerves. If that drop is put in and they still have pain, usually it's called neuropathy, meaning there's sometimes a central neuropathy in the brain, which I mentioned the circuits are kind of signaling pain, and it's not really coming from the actual peripheral nerve, because the peripheral nerve has been kind of anesthetized with an anesthetic drop. So that's how we can tell if it's a centralized neuropathy. We can take a look at the cornea and see if there's inflammation on the cornea called keratitis. Whenever there's inflammation in the cornea, the defense of the cornea, the nerves are exposed. The cornea is the most sensitive part of the entire body for good reason. It's an important organ. Vision is crucial. So whenever you get something in the eyelash in your eye, it can be excruciatingly painful. And so if you're walking around without any cells on the cornea, your nerves are exposed to the world, and it is very uncomfortable. It can be very painful. It can be constant discomfort and pain. So that's how we use generally the techniques we have in the office. There is something called confocal microscopy, which is usually available in academic centers, like University of Maryland has one, Johns Hopkins has one, Harvard has one, Stanford has one. Most offices don't have it. It's a specific machine that actually does this. The use of confocal microscopy can look at the actual nerves of the cornea and determine if there's a nerve problem that needs to be treated.
Okay. Thank you. And then last question, and this is kind of a two-parter. It has to do with artificial tears. One, how many times a day should we use them? And are these artificial tears, do they have minimum ages for using them?
Great question. So most patients, we have patients that are even babies that have had to use artificial tears for various reasons because of surgery and so forth. So no minimum age. Preservative free is the name of the game. If it has a preservative, it can cause some damage in the future. So we really want non-preserved artificial tears. We generally will tell patients 4 to 8 times a day, but we've had many patients that need it every half hour, every hour. It's one of those things that's just trying to soothe the nerves, soothe the inflammation. Putting in the refrigerator, as I mentioned, sometimes helps with that discomfort, redness. That's part of the reason why we love platelet-rich plasma and autologous serum, because artificial tears are helping with the symptom, but platelet-rich plasma and autologous serum and even cord blood serum and even stem cell drops, which we have used, help the symptom, but they also heal the cells. So that's your own body healing your own tissue that's been damaged. So when you cut your finger, your platelets are what heal you. And so that's why we like platelet-rich plasma, or even your stem cells in certain cases can help as well. So that's why we will use those really advanced technology options in patients that find that artificial tears are not enough, or they're having to use it every 15 minutes and it's not doing anything. We hear that a lot because it's like just lubricating but not healing. And so if that's the case, if you're having to use it more than 4 to 8 times a day, we need to go to the next option to get you better faster. Thank you. That's a great question.
All right, Dr. Cremers. Well, thank you so much today for presenting this evening. This was a really great presentation. For anyone who has any more questions, please feel free to shoot me an email and I'll get back with you with Dr. Cremers. But otherwise, I hope everyone has a great rest of their evening, and stay tuned for all of our other presentations coming up this week in the next couple weeks.